जी कैसे हैं आप?
Good. How are y'all? Good.
Excellent. कृपाल जी हाय.
Hello, Chaturvedi ji. Good evening.
Yes.
Hello, Dr. JK. How are you?
Fine. All well.
చక్ర సైన్ చేసే వరకు ఎందుకు కూర్చున్నారు మరి? ఎట్లా తీసుకెళ్ళి సైన్ చేయించావు అది?
Hi, Rita.
नमस्कार.
Hello, good afternoon, Ms. Govil.
Good afternoon.
Yeah.
Your guests have not come, Dr. Chaturvedi.
हाँ जी.
आपके guests हैं.
Hello, good afternoon, Ms. Govil.
So it is also going on YouTube. Yes. I was trying to make sure of that. Yeah. I'm just waiting for some more people to join so that we can start. Of course, main people have come anyway. Yeah, people are joining. I'm happy about it. Dr. Sunita Gupta, namaste.
Namaste.
Namaste. Yes.
How are you?
I'm doing great. आप कैसे हैं?
Padhiya.
Yeah.
So
Should we wait for the other people or shall we go ahead?
Yeah, I know. Actually, I had to download Zoom again. So I thought I will start early. Otherwise.
Thank you so much.
Okay. Thank you.
Yeah. Rita ji,
Yes.
Messages have gone to all your members, right?
Come again, sorry?
Message has gone to all the members of ICS.
Yes. We put it in all our WhatsApp groups.
Yeah.
And many of them have said they'll join. So I think they'll slowly join in. Yeah.
Yeah, I know. But
it's a good topic and everyone
waiting for
was
some
keen
time
to...
or...
No, it's a very good topic and we all want to...
I know.
We're very keen to listen to it. Yeah.
We have taken a lot of trouble to get the speakers also.
Speakers. Yeah. How is your vaccination program going? Good.
The problem is, after seeing the news item in Economist, that 8,000 vaccines are wasted in Delhi.
Yes, that was so sad.
I had a heartthrob. I thought, without giving awareness, starting the program is not correct.
Correct.
So we thought we will make a big awareness program.
Yes.
So today we had a morning walk commemorating the HPV, World HPV Day.
Correct.
And we had a press conference on the 2nd, which had come in all our newspapers and TV channels.
Yes.
And today we are having a Zoom. We'll continue this so that the trend is kept going.
Yes, even Women's Day and all you can.
And the excuse that they have given for wasting so many vaccines is lack of knowledge. There were no takers.
Yes, nobody knows. That's there.
See,
But that was very sad. So many vaccines. It's so expensive and
8,000 into almost say 2,500.
yes,
That is small money.
not a small amount.
Several
not
crores.
small. Yeah.
Anyway, that's all the money you and I paid as tax. So it doesn't pain
I
the
know.
politicians.
Yes, definitely.
They only see how much more tax can be collected from all of us. It is already 5:04. We'll
I think you should start. I know.
Yeah,
People
we
will keep joining in.
1 minute we will start.
Yes.
Our own people have not still joined. That's what I'm seeing. The person who has
Good
to give
evening,
us
Dr. Chaturvedi. Good evening. I'm Dr. Leela this side.
Okay.
Your two lady doctors have joined.
Yeah, Dr. Leela is joined. She's on the panel. So
Leela ji,
Yeah,
namaste.
yeah.
Namaskaram, ma.
Namaste. Namaste, Andy. Namaste. Good evening, everyone, whoever has joined here.
good evening.
Evening.
Good evening.
Good evening.
Hi, Dr. J.K. Singh. Nice to see you.
After a long time.
Yes.
How things are going on, ma'am?
Going on, galloping on. So
Yes.
we're all running behind trying to catch up.
You are still very, very active. I must say.
Okay, then we start off.
You can start, Chaturvedi.
We'll start, I think.
Yeah, you can start.
Yes. Okay. I'm just seeing that the system is working. Sir, DG introduction. Okay. Log in, please. Please log in because I don't have copy to introduce. Renuji, namaste. I think
Namaste.
I think we will start. I would request let me introduce the speaker. That is my responsibility. Our chief guest is Madam Josna Govil. Madam worked as a volunteer with Indian Cancer Society since 1985. Honorary Secretary and current Chairperson, Indian Cancer Society Delhi branch. Member of Global Advisory Committee for our views, our voices initiative of the NCD Alliance and people living in NCD since June 2020. Founder member of APAC HPV consultation. She represents India on the board. Other countries are Singapore, Malaysia, Taiwan, Korea, Hong Kong, and Australia. Thank God. And then Mrs. Govil has been a strong advocate of NCD prevention and control. She has been getting the Healthy Indian Alliance as a member of the governing board since the inception in 2015, particularly to work on related to meaningful involvement of people with NCDs. Former Vice Chairman and Honorary Secretary, Indraprastha Cancer Society, a parent of Rajiv Gandhi Cancer Institute and Research Institute. We are very proud. Member of National Managing Committee, ICS, first President of ICS Cancer Sahyog to the 1991 to 95, and she had a Lifetime Achievement Award for long years of dedication to cancer control. World Health Organization Regional Director Appreciation for contribution to public education on hazard of tobacco use. Ray of Hope Award for the International Conference of Oncologists in Bangalore. Alumnus of UICC, ACSU, presented papers in various international and national conferences. Selected as one of 500 in the world cancer leaders in the year 2009, and the Livingston Conference in Dublin, Ireland. Wrote a regular column, the Communique magazine of the Confederation of Indian Industry for 2 years. Former member of the Review Board and Ethics Committee for 12 years at Rajiv Gandhi Cancer Institute and Research Institute, New Delhi. Ma'am, we are very proud to have you here. You have got, a 3-page biodata. I found I could not understand some of the things that are given in that.
Don't worry, Dr. Chaturvedi.
It's a privilege to have you here today. Over to you. Please give the inaugural address.
Thank you very much, Dr. Chaturvedi, and greetings to everyone else there. There is a very distinguished board of doctors who are waiting to speak. So you'll forgive me if my introductory speech is very much in the nature of an overview. My greetings to Rotarians. I don't see any of them, so I presume they'll walk in late as usual. That is because I'm also a Paul, whatever he is, fellow. And so I'm very familiar with Rotary meetings. Today is International HPV Day. And as far as I know, this is the first time that it is being celebrated in such a big global fashion. I want to draw an analogy between HPV and COVID, because I think everybody today understands COVID, they understand the term virus, and they understand the precautions that have to be taken with this virus. Let's take two people, A and B. A is vaccinated, follows all the rules of hand washing, safe distance, masking, etc. And B has not been vaccinated and does not even know about masking, hand washing, or keeping a safe distance. When COVID strikes, who do you think is going to suffer the most? Obviously, the person who is not vaccinated, who does not follow any rules, who does not even try to understand what this virus is.
Okay.
HPV is exactly the same. It's been around for a very long time, and it is such a common virus. We're all scared of COVID, but we should be equally scared of HPV. It has been around for hundreds of years, and yet people tend to ignore it. HPV is the human papilloma virus. It is caused by skin-to-skin contact, and it can happen to young people who are curious about their sexuality. So it is not a judgmental matter. It is not that your child is promiscuous or your child is bad. It is normal human nature. So with acceptance of that fact, we need to educate people, young people, in schools. We need to educate mothers about the fact that there is nothing to be ashamed of. When you're asked to give a child a vaccine, it is not a judgment on that child's behavior. It is a normal precaution. And like you give the child also a COVID vaccine, you give that child an HPV vaccine. HPV is gender neutral. We talk of it in terms of women's cancers, but it is equally applicable to anal cancers, penile cancers, and esophageal cancers. So we will not pretend that the men folk or the boys are pure as driven snow and it is only the women who get this cancer. Yes, the numbers of cervical cancer are huge, and they tend to hide the numbers of people of boys and men who get oral cancers or anal cancers. When we started in the Indian Cancer Society, we started our crusade against cervical cancer, not yet HPV vaccine, because we didn't know about it. But we educated people about the virus and cautioned young people that it was all too easy to get infected. We started in 1999, and this was going to be our millennial goal, that we would make sure that people understood why cervical cancer was caused and to try and find ways of discovering it early. We set up what we call Pap Test India. It was basically Pap Test Delhi. And once the central government picked up on that phrase, we hoped that it really would be Pap Test India. Sadly, it has never seen light of day anywhere else. So now this year, the WHO has come up with their call for elimination of cervical cancer as a major hazard. The doctors among us will tell us the numbers, the statistics, and the horrifying pain of cervical cancer. In fact, of all gynae cancers. But we need to be aware that we have to take responsibility for our own lives and for the lives of our children. I talk to gynecologists in small towns. I hear very encouraging stories about a mother of 3 daughters who sold the excess bartan in her house to get her daughters vaccinated, and also made sure that the neighbor's daughter was vaccinated with them. How many of us can even think of offering vaccination to 2 young girls, to our own daughters, maybe our granddaughters, maybe the neighbors' daughters. If each one of us could just take responsibility for 2 people in addition to ourselves, this message would spread very fast and our daughters would be safe. We've been struggling to try and get the HPV vaccine as part of the National Immunization Program. We keep talking to the government about it, and invariably we come up with the same brick wall. It is expensive. The government cannot afford to put it on the National Immunization Program until something cheaper comes along. So from 3 doses, it has come down to 2 doses. Now there is a nanovalent vaccine of 1 dose, which is, I'm told, just as effective as a 2-dose vaccine. So let's work towards twisting a few arms, not only of the government, but also of the pharma companies, and getting this vaccine to become cheaper. Dr. Chaturvedi asked me about the HPV DNA test. Again, I will defer to the doctors. I hope you will address us on this. He asked about the price and whether we as NGOs could afford to offer it to the women around us. Dr. Chaturvedi, I think the women of this country deserve the best. And we cannot keep offering them a VIA or VILI when we know that there are better methods. Even the PAP test is a very good method simply because it is objective. It does not depend on one person's visual inspection. The PAP test has to be seen by 2 people, the gynecologist and the pathologist. So that test result is accepted easily. The HPV vaccine is much the same. But the great difference is that if you give a woman 1 test, 1 HPV DNA test at the age of 15 or thereabouts, she needs only 1 more in her lifetime. So in the long run, it is economical for the woman in discomfort, in cost, in every other way. For us NGOs who charge per PAP test, or for the pharma companies who charge per reading, it is going to be much less profitable perhaps. But for a change, let's put the woman first. Let's close that gap between the care that every woman deserves and the care that she actually gets. Thank you very much. And let's get on with the rest of the conference. You're muted. Dr. Chaturvedi, you're muted.
Yeah. Thank you so much, ma'am. Very kind of you for your inaugural address, which is very exhaustive and also, educative. I mean, we are proud to have you here today. There is another very important person, Dr. J.K. Singh, who is an awardee of Padma Shri.
Yes.
And then who is almost an authority on cancer. He worked in Mahavir Samsthan as a director almost for about 25 years and then did free service. I would like to hear Dr. J.K. Singh say a few words, please. Unmute yourself, sir.
Yeah. Thank you, Mr. Chaturvedi. And to all the persons who are participating, particularly this webinar. it's a very important topic, and I really congratulate Mr. Chaturvedi for bringing the most topics, most of the topics, which are really, really very much needed to be discussed. And HPV vaccine is for the last so many years in the practice, but still there are many issues, I think, which needs to be discussed with HPV vaccine. Things are getting very easy when we are covering this topic with various types of difficulties which we are facing. And I'm sure the HPV vaccine is the most preventable weapon to become as an epidemic, cervical cancer. It can prevent it. And HPV vaccine is mandatory, and it has become mandatory in most of the countries, more than 100 countries. But I don't know why it is not very much popular in developing countries, and a country like India. It's not very popular. Every time we are pursuing that people should accept it, people should popularize it, government should popularize it. We have many times discussed this thing with the health ministers also, state health minister and the central ministers also. But I don't know why they are not insisting, not focusing a thing like HPV vaccine, which can prevent the cervical cancer up to 90%. They are not doing. I don't know what makes them not to do these things. And I had so many persons who are talking to me about this particular type vaccine. I think the price is one factor, and the people are not very much willing to have it. There's the two.
Don't worry.
I think price is never a factor.
You have any problem?
It's never a factor. At least a large subset of persons today in India, they can afford to have it. I think first they should take the vaccine, and then we should talk about the poor. Once they start taking the vaccines, doctors, even the doctors are not taking. Even the doctors who are not taking these vaccines. When everything, there's nothing, any bad effect or anything against this vaccine, but they are not taking it. So we should give more focus, more concentration, and unless until government doesn't take it, I'm sure this will not going to be popularized. Government must come forward, and they should, as just like COVID. In 1 year, COVID vaccine was made in the market, and it was practiced. But it is for the last 15 years, the practice is going on, and the research is going on, and almost, I think, many crores persons were vaccinated. They did not have any type of side effect. But I think people are not accepting it. So things must be seen in a different manner. Unless until we don't make a unity among all the social workers, all the NGOs, and we should go to the government. We should go to the government. We should persuade the government. We should make this vaccine in the vaccination schedule of the government of India. If we can do that, probably we'll be able to save lakhs and lakhs person who is going to have cervical cancers, and they will be, I think, saved. They can be saved for that. So I'm sure Jyotsna ji and everybody, they should come forward, and there are many persons in the medical fraternity also. They wanted that this vaccine should be given to most of the poor persons also, what I'm finding, unless until we don't come forward we don't get our wards vaccinated. And doctors should come and they should get vaccinated. Unless until we don't do that, it will not be popularized. And the government should also be aware of that. And government should be pressurized to make this vaccine in the vaccination schedule of the government of India. Thank you very much. Thank you very much, Mr. Chaturvedi, for bringing this burning topic in the today is the vaccination day, and the entire world is going to focus on this particular issues. I'm sure this webinar will certainly give some light on the new concept of popularizing this vaccine. Thank you, Mr. Chaturvedi. Thank you, Mr. Yosanaji.
Thank you so much. One very unfortunate news that has come in the Economist is that 8,000 vaccines are wasted in Delhi, and the reason given is lack of knowledge and no takers. Now, don't you think this is something which is atrocious? Because unless you have really created the awareness, why did people take the COVID vaccine? As you rightly mentioned, they're worried about their life. They know they will die if they don't take. But that type of awareness is not created for the last 15 years about HPV. I think we should be blamed on that for not creating awareness. I don't know. That's why we thought we wanted to start off with the vaccination, but then we realized after seeing that news item that without giving proper awareness, starting this project does not go. We have a project to go for 10 years to come. We want to vaccinate almost about 7,000 to 8,000 girl children every year. Concurrently, we are also screening women for cervical cancer. So, I mean, I hope the realization comes. People, every 5 minutes, one lady is dying because of cervical cancer, but the realization is not coming in people. This is very unfortunate. I would now request our Rotarian Kripal. Is she there? Rotarian Kripal? Okay. Now, our next speaker is Dr. Himabindu Singh. Dr. Himabindu Singh.
Sir,
yep.
sir,
Kripal, are you there?
Yes, sir, I'm there. Sir,
You are there, but then
Krupal is not there.
Kripal is not there. Sir, that's why I'm introducing you, right? Yeah. Dr. Himabindu Singh, Additional Director of Medical Education, Principal RMC Telangana, former Professor of Pediatrics, Department of Neonatology and Pediatrics in the Institute of Child Health, Usmania Medical College, Nilofer. Then Nodal Officer for Yuva. Yuva is an organization which takes care of adolescent girls and boys. Center for Excellence of Adolescent Health, Nilofer Hospital. She has been President of Indian Academy of Pediatrics, Twin City Branch, President NNF, Neonatology Forum, then Convener, Technical Advisory Group of Birth Defects and Newborn Survival for Asia Pacific Region, APPA, Organizing Secretary of the Conference, Executive Board Member of Central IAP, National Faculty in Pediatrics, UG and PG Examiner. Then she has about 55 publications to her credit. Now over to Dr. Himabindu Singh. I'm sharing the screen.
Sir, you will share the screen, sir, the PPT?
Yeah.
No, sir. Can I share the screen or you will share?
I think I need to share the screen. Is it not required?
So I will forward my PPT to you, sir.
Yeah, okay. You want me to make you co-host or what?
You can do, sir, if you can. Make me host.
You can share from our end, madam. You can just press share screen and start sharing your presentation. That will be easier. You can control better.
No, I'm not able to share because I'm not the host.
I'm already sharing, okay? allow Zoom to share your screen. Yes. Oh my God.
Sir, I have sent my PPT to you.
Have you sent it to me?
Yes, on the WhatsApp.
Oh. Now I realize I'm turning old. Till now I never thought I am. Please wait
So
for a minute.
if you give me the access to share the screen, I can do it.
I'm trying to share the screen, but then I
No,
can't see your. I can't see your. I can't see your desktop.
No, sir, can you make her co-host?
No, you.
Yeah.
You
I
can you
can't-
make?
No, Dr. Himindo, I can't see your presentation on the screen.
Sir, no, sir,
no.
I have sent it on your WhatsApp. You have to download. Or otherwise you make co-host.
Chaturvedi garu, you can make co-host to Bindu as well as me so that we can share our own screen.
Yeah, that
Okay,
will be
1
easier.
minute. Enable waiting room, chat room, unmute, share video.
How are you, Navneet?
Where do I handle to share?
If any other person, not himself.
Sir, who's with you?
You can click on her name, sir, or the name, and just click on that. You get more permissions where you have that making of co-host option will be there.
Okay. Okay. Oh, here, yes. Make
Okay.
co-host. Yes,
Yeah,
I made you co-host.
You can make all the speakers as the
I
co-host.
made you co-host. Go ahead, please.
You can make me also co-host.
Yeah, all the speakers you can make them as co-host, sir.
Yeah, you are already a co-host now. Himabindu Singh, please go ahead.
Yes, sir.
There it is. Your folder.
You can host your presentation now.
Dr. Navnihal ji. Dr. Navnihal,
Yes, tell me.
are you able to share the screen?
Yeah, I didn't try that.
You
We
try
are not able
because
to
I
see.
send.
We
I
can't
will
see
send
your
my
screen.
PPT to you on the WhatsApp. Otherwise, I will tell orally without PPT.
Then it's showing host disabled participant screen sharing. The host has to enable us.
Disabled participants. Are?
So, okay.
You have disabled,
Chaturvedi garu.
I made you co-host. You have disabled it.
No, listen. Sir, are you, who are the audience, sir? If they can understand, I can speak without slides.
Okay, go ahead.
Okay. So because I'm not, we are wasting some time trying to do the tech, sharing. So basically I have some slides, good slides actually. Just like
can you just wait a second, ma'am? Just a second. So can you make me as a co-host, Chaturvedi garu?
Yes,
Yeah.
I'll
I'll just try from my end so that you can share the screen.
Parvaledandi nenu start chestanu.
Okay.
You can continue, Bindu.
Welcome
to the process.
Okay. Fine.
Okay,
I
because
can't get you as co-host here.
Yeah.
The choice
it's okay.
is
Let me start. Let me start, sir. I would like to thank you, Chaturvedi garu, for getting all of us on board to think about what we can do for the young girls and prevention of HPV, human papillomavirus infection, and especially the focusing on the vaccination program. And I'm really privileged working from Nilofa Hospital and Yuva as the nodal officer to be associated with Rotary. And we have launched together a program of enhancing the HPV coverage for young girls. On the eve of the World Women's Day, International Women's Day, I should say, it is a very good initiative by Rotary to create awareness among public about the cancer and which is affecting women. And we all know that HPV virus causes cancer of the cervix. And this is the second most important cancer in women. The incidence is 14.9 per 1 lakh. And there are about 96,922 cases of cervical cancer occurring in India. And of these, 60,000 or around die every year. That's a huge number. See, nobody of us are knowing that such is a large number or the burden of cervical cancer in India. So it's the second most common cancer, making the woman die prematurely, and which is actually preventable. Still, we are not focused enough on this. And the high-risk HPV types are found in 97% of cervical cancers, and there are different types, especially type 16 and 18 cause 70% of cervical cancers. And the 6 and 11 also cause, but about 90% of genital warts. Now, regarding the HPV, human papillomavirus, though it is for even all of us should be aware of this. We can create awareness regarding this virus among young women and also boys, that this is a papilloma virus, and it is actually causes persistent infection.
I want to make it, I'm not able to do it.
Persistent infection, and this the persistent infection is a prerequisite for development of cervical cancer later in life. And there are actually more than 190 types of HPV vaccine, but the high-risk types are few, especially type 16 and 18 are responsible for 70% of all cervical cancers burden in women. The natural infection does not offer full protection against new HPV vaccine. New HPV infection. Sir, can you mute yourself, sir? Chaturvedi, sir, can you mute yourself?
Oh my God.
Chaturvedi, sir, can you please mute? Please mute yourself, sir.
Oh, sorry.
Okay. So HPV virus causes more than cervical cancer. It actually, in effects, it also causes warts. It causes head and neck cancer, anal cancer, penile cancer, vulvar cancer, vaginal cancer. But the most, cervical cancer, it is 100%. So once there infection, slowly many of them turn, into some, it causes persistent infection over a long period. It can become cancerous later in life. And what is the mechanism, transmission, all this we have to make the
I think there is some problem. I think there is some problem with her. Chaturvedi, can you continue? Can you unmute yourself?
Shall we go ahead with the next speaker? Hello, can you hear me?
Sir, you take somebody's help, sir. Otherwise, it won't be interesting for anybody to listen, or without PPTs, how can we present?
Just a second. Sorry, ma'am. Just a second. Chaturvedi garu, you are again the host now.
Okay.
You can just make it host.
Sir, sorry, sir.
Go ahead. Now,
sir, just please, sir. Chaturvedi, sir. Just please listen to somebody's instructions and follow, sir. Then it becomes easier. Somebody wants to take over as a co-host. So please listen to her instructions and follow. Then it will be easier, sir.
Sure, ma. We'll do that.
Please, somebody wants to help you, sir. Please take their help.
Yeah, just a second. Sir, can you just make me as a co-host?
Now I am the main host, is it?
Yes.
Shall we make Dr. Himindu co-host?
Yeah, you can make me co-host. I'll give the permissions for sharing everything for the others also, sir.
Okay.
You can make Vani.
Can I make you the host?
No, 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 don't make me the host. Make me a co-host.
See, I got columns here. Mute, stop video, chat. That co-host has not come.
Click on my name and you'll get the option for making the co-host.
Okay.
Chaturvedi garu.
Amma.
Koncham naadi complete chestanu sir.
Meer maatladandi, please continue.
కొంచెం అదే కొంచెం క్వైట్ గా ఉంటే నేను కంప్లీట్ చేస్తాను సార్. Thank you. So yeah, okay sir. So I was just saying that our young girls are not even aware about the transmission of HPV vaccine, HPV virus. There many of them are not even aware. There's something called human papilloma viral infection which they can get, and it can lead to persistent infection and cause problems for them in the later life. There's hardly about any awareness about this virus infection among young girls. So it is our duty, the doctors and NGOs like all of us who want to empower, fight against the cervical cancer, should actually empower the young girls about give them knowledge about how this is transmitted. So we all have to tell them it comes through sexual intercourse and it happens through sexual contact, and it can be the genital HPV infection in virgins is very rare, and actually but may result from non-penetrative sexual contact also. Proper condom use may help reduce the risk, but is not fully protective. And we also have to tell them about sexual contacts. Vertical transmission mother to child can happen, fomites, etc. But major route is the sexual contact. So therefore we are focusing on prevention before the sexual debut. So this is very important. We have to make this aware. This knowledge should be given to the young girls and also to the parents who are deciding for their future of the children. So what happens? What is the history? How the HPV vaccine can lead to cervical cancer. So once there is an infection of the cervix with human papilloma virus, so there can be sometimes a transient infection, and this will be cleared. I mean, it really goes out and doesn't have long-term implications. But over 2 years, sometimes it can lead to a persistent infection. And this persistent infection over another 2 to 5 years can lead to low-grade dysplasia. And this can be at the first stage. And then after another 4 to 5 years, can lead to high-grade dysplasia. And that is invasive cancer is seen after 9 to 15 years. That was totally about nearly 30 years. 30 to 32 years after primary infection, then it can lead to invasive cancer. So that is a long gap, but many people are not even aware that this infection has to be screened. The early stages of cancer can be screened through pap smear. That is also not, unfortunately, not popular in India. Many women are very busy with their domestic chores, taking care of the families, children, but they hardly go for timely checkup and screen themselves for this infection, which can be seen by doing a pap smear. So even this awareness is not very high among our young girls. So we need to really work on both screening and also prevention. So what is the burden of cervical cancer worldwide? It is actually huge. New cases happen. 5,27,624 new cases annually are reported. And it's the fourth common cause of female cancer, and second most common female cancer in women aged 15 to 44 years. So in this age group is the second most. And regarding India, what is the burden of cervical cancer? So India has a population of 436 million women aged 15 years and older who are at risk of developing cervical cancer. And India alone accounts for 1/4 of cervical cases and deaths worldwide. So this is a huge burden. New cases annually reported is 1,22,000. And again, the second most common female cancer, and especially the age group of 15 to 44 years. So the deaths also reported very, very high mortality. 2,65,672 deaths are reported annually. And even in India, 67,474 deaths are reported annually. So this is too high. If you see every day, 185 women are dying every day due to cervical cancer. And every hour, 8 women are dying. and one woman is dying every 8 minutes. So that is the huge burden of cervical cancer in India, and it is high time we all do something about it. So what can we do? So the reality is we have a screening mechanism. We have a screening mechanism. We have a vaccination program, which is not very popular. We need to work on both these issues. So both vaccination and screening are essential to address the cervical disease burden. The screening rates among Indian women are very, very low, which I just mentioned, just 2.6%. Even for women with normal cytology, the HPV prevalence is 7.9%. So screening and vaccination go hand in hand to have maximum impact on cervical cancer reduction. So women who have been vaccinated should continue with the cervical cancer screening. Screening is not recommended before vaccination in India. So there's a significant decline in prevalence of HPV types the abroad also. There is a lot of evidence, like in Australia, there's a significant decrease in prevalence of HPV post-vaccine. So there's a lot of evidence that vaccine helps, and Australia has a very good track record to eliminate cervical cancer totally just with the help of vaccination. So this is, among the women aged between 18 to 24 years, Australia has shown a huge drop from 22.7% to just 1.1% over the last 10 years, 1 decade. They have brought down drastically the percentage of cervical cancer, and this is only through vaccination. So before the vaccination program, almost, in Australia contracted HPV. So because of the vaccines, International Papillomavirus Society is there, published on in a report saying that cervical cancer could soon be eliminated as a public health problem in Australia. So why, when Australia can do it, why not India? No, I think we have to really wait. And let's talk about a little bit about this vaccine. So we have only 2 things. One is through vaccination. Second is through regular screening and early detection. So this is the only way we can bring down the mortality due to cervical cancer and save women of our country, because this is a huge burden in India. We have already seen the statistics. So regarding the HPV vaccine, we have bivalent and quadrivalent vaccines, and without just trade names, I just mentioned it is Gardasil. Somebody is, please, I request all of you to mute. Can you mute yourself, please? Yeah.
Can you please unmute?
Thank God. So there's a lot of war situation outside. I hope it doesn't come into our rooms. Yeah. So we have quadrivalent and bivalent vaccines, and both these vaccines protect against HPV type 16 and 18, which are the ones which are causing cancer. And quadrivalent also has, their protection against genital warts also. Both are safe and effective, and both have stable antibody levels.
Yeah, voice is breaking, ma'am.
And continued efficacy even after 5 years post-vaccine. To 14 years, we recommend 2 doses, 0 and 6 months, and 15 years and older, 3 doses. That is at 0, 1, and 6 months. That is, we have to remember. For 9 to the above 15 years, it is 3 doses, 0, 1, and yes, sir. Am I audible? So the HPV vaccine has a public health. So it has been taken up by the program. Yeah. I hope I'm audible now. Yeah.
You are, yes.
Public health perspective. Yeah. When the public health perspective, sir, we have to see that the vaccine has become very popular, and we all have to recommend the governments to give free of cost to all our people in their universal immunization program, because we have seen costly vaccines like the pneumococcal vaccine, rotavirus vaccine, all that have been slowly included in our universal immunization program. So why not HPV? I think it is time now. We all have to recommend to the state governments and the union government to protect our girls and women from this dreadful cancer. We have to strongly advocate for including the HPV vaccine in the UIP schedule. So the cost should not matter, because we are really saving lives, and we have already included a lot of other costly vaccines. I think people should advocate for this. There's little we need to do more strongly. So I just want to mention about UVA, which is the nodals, the State Center of Excellence for Adolescent Health in Nilofer Hospital, which is where we are giving this vaccines, HPV vaccine for young girls. So this UVA is actually one platform, common platform to address physical, mental, psychological, sexual, and a lot of other problems under one roof. We understand that young girls and boys, they don't walk into any center on their own, saying that I want to have guidance for relationship issues, substance abuse, suicidal tendencies. So they feel hesitant to talk. So they are not comfortable with their parents, neither teachers. So knowing the need, and we all have to also, I want to highlight that adolescents are 25% of our population. Every 5th person walking on our road is an adolescent and the teen. So they have to be protected, and they have different health issues, pubertal problems, they have body image issues, psychosocial problems, high-risk behavior, experimentation, drug abuse, sexual abuse, and the sexual reproductive health problems. And they don't have life skills. They don't know how to say no. They cannot negotiate in relationship. They cannot protect themselves with condom. They are not even thinking about contraception, but they are sexually active, some of them. So they require help. Let us now openly talk to them, but in a very sensitive way, and give them privacy, confidentiality. So we render this service under a service package with all the WHO criteria for a youth-friendly clinic. So where we respect them, we give them privacy, confidentiality, and we are one-stop service, quick services, and most important, the non-judgmental attitude. All the doctors, anybody who are serving in this UVA center, we have social workers, psychologists, gynecologists, they need to be non-judgmental. So they cannot judge a character, saying you are a bad character, good character. Adolescents don't like to be judged like that. So we need to be pleasing. We need to be knowledgeable. We need to know the signs of adolescence, how they are growing up, what changes are happening in their body, why are they behaving like this or that. So if the comfortable and appealing ambience should be there, and only when we are meeting this criteria, they will come and open up with us. So while we are addressing other problems, slowly I initiated this HPV vaccine, saying that you have to take care of yourself. Now you are old enough, take the responsibility, and your parents will also be told about it. But you need to talk and ask your parent, please give me protection against tetanus, against the hepatitis A, B, then typhoid, MMR vaccine, COVID vaccine, and also HPV vaccine. So at this age, at 10 years, we need to give them boosters. So, but this is again not popular vaccination program in India. Only program up to 5 years vaccination is very popular, and especially the new and about after 5 years. Even the parents feel that vaccine is only for small children. So we need to really do a huge awareness program with the parents, talk to them in the schools, colleges, in the parent-teacher meetings, and utilize all media. And there are a lot of groups, social groups on the media, parents groups are there. So we can actually connect with them. Now, digital media is very powerful. We can connect from anywhere to them, talk to the parents and also to the adolescents about this vaccine and about HPV infection, how that can cause persistent infection and cause cancer about 30 years from now. So we have to talk to them, and so that the demand is generated. They will start asking for this vaccine. And once the demand is generated, the company's production will be more and the rate also will come down. And we all have to also advocate strongly to the government to include them in the UIP. So youth are the asset for us in our country. You can see they are the future for us, immediate future. So, but they are very sexually reproductive health is, they are sexually active, their puberty set in. So they have to be protected before their sexual debut with a good vaccine, very efficacious vaccine. So HPV is the right vaccine to be given before the sexual debut. Please, all of us, let's work towards this, because Rotary and Nilofer has come together, and we want to do it not just in Nilofer. If I am now as a principal and dean in Ramagundam, and I can take this up at the state level also. But once the COVID infection comes down, already now pandemic is coming down. Now the government officials are likely to listen to us, because there were so much of all the resources have gone towards pandemic, the management of pandemic, and therefore we didn't have that, the thing to say. They asked us to wait. So now our time has come. In a month or two after the pandemic is declared that it is now we are in the low ebb, we can start talking to the ministers, to the policymakers about this vaccine. And I am with the Rotary, all of you, and I'm a big advocate of this vaccine. I hope our youth will be protected, especially the girls and the boys, but especially the girls, because they're not even aware that such human papilloma virus is one virus is there which may cause infection of the cervix, and persistent infection can lead to cancer. In simple words, we need not be very technically too much medical, but simply, but a doctor tells them, it is, I feel that they are more receptive. And therefore, I have joined this program all with you to create this awareness about HPV infection and the vaccine being available. And let's hope we take it as a big movement this year and protect our young women from this dreadful disease. And this is going to be a big tribute to the women of our country on the eve of the International Women's Day. Thank you, one and all. Thank you so much. I had some very good pictures of Yuva, which I'm not able to show, but sometime, maybe next time I can show. And I all invite you to come and visit our Yuva Center at Nilofer Hospital. There's one floor on the adjacent of the intensive care block, and I have mobilized funds in the MP-led funds. One floor is there. We have 2 rooms in our OPD also. After the OP, we want to conduct programs in our center, which is actually less utilized because of the COVID situation. We couldn't get the adolescents coming in. Now, since the pandemic is almost over, or at least at the end, we are having less cases now. I am actually offering this space to be utilized by Rotary. You can conduct your programs with youth. Kindly mobilize young people to come to the center free of cost. We can, because we have an understanding with you. I am ready to offer this space to you for empowering purpose, for information purpose, for programs to be conducted with young people. So any child between 10 to 20 years plan some activity. I highly recommend and suggest that you can come and see the center and utilize, so that I'll feel happy that this center is being utilized for the young persons by all of us. So it could be Rotary, it could be Nilofer, anybody else also welcome. So I welcome all of you to work with us. Thank you so much. Thank you. Hello.
Can you unmute yourself, Chaturvedi garu?
Thank you. Very, very, very informative.
Yeah. You are the person who is in government now, and Harish Rao is an excellent minister.
Yes,
Now,
sir.
Punjab government has started this on its own. They did not wait for national immunization program to include this.
We'll
And
put,
then
I will
Sikkim
meet
government,
Harish Rao, sir.
1 minute,
I
ma'am.
already-
Sikkim government also has taken up. Now,
Sikkim.
it is now time we should take up, and you be the force. We are all behind you.
Sure,
Not a
thank you,
problem at
sir.
all.
Sir, when I meet Harish Rao, sir, I request some of you to join me. I will take out time
Positive.
and then we'll meet him.
We'll be too happy to join you. We'll also put in our word and the efforts we are making so that he'll
Sure,
understand
sir.
it.
Thank
Positively
you.
we do. We need
Okay.
you to take the lead because you are government, we are non-government. So you
Sure,
should.
sir. Thank you. Right.
Thank you very much. Now
Thank
our
you.
next speaker is Dr. Naunihal Singh. Dr. Naunihal Singh is I have his biodata. He's a pediatrician, adolescent and obesity specialist. Then Director, Tanveer Hospital, President, Tanveer Foundation, Trustee, Guru Nanak Foundation, Member, Guru Nanak Health Center, Secunderabad, then past Joint Secretary of India Association of Advancing Research and Obesity, Vice President of All India Association of Advanced Research and Obesity, Secretary for Adolescent Health and Health Academy, Member, Global Association on Physicians, oh my God, of Indian origin, Member, International Society of Pediatrics and Adolescent Diabetics, Member of Neonatology Forum, Member of Epileptic Society, Member of Indian Academy of Pediatrics, Member of Pediatric and Clinical Care, Instructor, Neonatal Resurrection Program, Past Instructor, Pediatric Advanced Life Support. He has been practicing for the last 40 years. We are very proud to have you here, sir. I think you are the right person to take lead with all the now Sikh Samaj is doing a great service to the world, not only in India. And I think we should take up with Gurudwara committees and see that some donations come in, and we should be able to really make this happen in Telangana. Over to you, sir. Please go ahead.
Thank you, Chaturvedi Garu and all the other faculty members. I'm very happy that you have chosen this topic and you are taking it forward by the march which you had today morning from Malareddy College today, and it was a very great success. I could see the number of people joining it and motivating people by having programs which will help people to know what is cervical cancer. Let me tell you, cervical cancer is definitely a preventable disease which is caused by HPV. It is the only cancer which is caused by a virus. See, the basic thing which I have been noticing is whenever you try to motivate the people or try to tell them in different forms, they will not listen. But suppose if you include it into your immunization schedule for the pediatric age group, then at that time, people will come and ask for the vaccine, and definitely they will take that vaccine as a routine vaccine. They think it's a regular routine vaccine, which is important for them. So this had been seeing it, and at my center, I have noticed that almost about 90 to 95% of the young adolescent girls go for the cervical HPV vaccination. So now the most important point which we have to emphasize here is bringing awareness. Now, let me tell you, in this meeting only, we had been trying to tell all the educated people. But see, the number of people who are joining this program are very, very few. So our people are also not interested in knowing the subject also. So how can we motivate other villagers or rural people to take up this vaccine? So let us come to the point now. Cervical cancer is definitely a preventable one. First, let us know what is a cancer. A cancer is an uncontrolled growth of certain cells in the body causing tumors or growths, but not all growths are cancers. There can be other growths which are not non-cancerous. Those cells which may spread to other parts of the body and can interfere with their normal function are known as the carcinogenic cells. So this is what is the cervix. The cervix is the mouth of the uterus, and this cancer is normally found at the mouth of the uterus. So this is what you see whenever they get a cancer. So that's the reason why pap smear is done to detect the cancer. So what causes cervical cancer? Cervical cancer is caused by an infection with a virus called human papilloma virus. That's why we have been emphasizing, insisting, and making everybody understand that this is a virus-induced cancer and can be 95 to 99% preventable. Approximately about 15 to 20 high-risk types are associated with the cancer. It is not just 2 types, but 16 and 18 are more common, and they are more commonly seen in that. And almost about 10 to 15 low-risk types are associated with the genital warts and other benign lesions. So giving a vaccine protects us from the cancer. In addition to that, it also protects us from the genital warts and all. Now the question is, what age group we are giving? I would emphasize that 9 to 14 years is the right age, because that is the age where the take-up is very good and they are not exposed to any types of infection. So the efficacy is almost about 90 to 95 to 99%. Most of the time, HPV infection disappears without treatment. Sometimes, however, HPV stays in the cells for years, and in some women, eventually it causes cancer. So we don't know who has got the cancer and who doesn't have the cancer. So we have to screen them. So what causes cancer? 16, 18, 31, and 33. So these are all the types which causes different types of cancers. It can be genital warts also, non-cancerous causing types of 1, 2, HPV 6, HPV 11. So in general, the HPV vaccine is a very effective vaccine. It protects almost about 99.7% from the HPV cancers. So it is not necessary that the cancer should cause only to women. It also causes to men. So 9 HPV serotypes have come into the picture now, are the leading cause of many cancers in Indian males and females. So what are those serotypes? They are 6, 11, 16, 18, 31, 33, 45, 52, and 58. These are the serotypes which causes cancers. And the types of cancers that are caused are cervical cancer, vaginal cancer, vulval cancer, and anal cancer. So these 9 HPV serotypes may cause 55 million cases of HPV cancers, and diseases in India is very, very high. Hemabindu has just mentioned almost about every 5 to 7 minutes, one woman dies of cancer. So HPV not only affects females, but males too. As per the global study, 6.5 out of 10 males have an HPV infection. Males are highly susceptible and have a low rate of seroconversion following HPV infection. Females have a high rate of seroconversion. That's the reason why we are insisting more on giving it to the young girls. So we should help protect both genders from 9 HPV serotypes that cause 80% of the HPV disease. So cervical cancer is caused by almost about 90%, vulval cancer 85 to 90%, vaginal cancer 80 to 85%, anal cancer about 90 to 95%, and genital warts almost about 90%. The HPV burden is even higher in India, causing 98.3% cervical cancer and 95% vulval cancer. So the other types of cancer which are caused by human papilloma virus are anal cancer, penile cancer, oropharyngeal cancer, anogenital cancer, and recurrent respiratory papillomatosis. So that is the reason why Dr. Bindu has been mentioning that Australia has overcome this, and it has brought down from 22% to almost about 1.5%. That is the reason why boys, young boys, are also to be immunized against it. And in women, human papilloma virus causes cervical cancer, vaginal cancer, vulval cancer, anal cancer, oropharyngeal cancer, anogenital warts, recurrent respiratory papillomatosis. So we are, as guardians, as protectors of young children and adolescents and all, we should try to protect both the genders, let that be male and female. But now our main significance is giving the vaccine to the young girls. How HPV is transmitted? We all know it is a sexually transmitted disease, genital skin-to-skin contact. And who is at risk of cervical cancer? The people who are between the age of 20 to 24 years, young age at first sexual intercourse, greater number of lifetime and recent sex partners, sex with a new partner whom we are not aware of their status, male partner having a sexual history, in addition to sexual behavior. Other potential risk factors include smoking, oral contraceptive use, nutritional factors. These are all the potential factors, but our main concentration is on HPV, where we are trying to screen, protect them from the HPV or cervical cancer. So what are the signs of cervical cancer? Early cervical cancer have no signs at all. That is the reason why it is missed. And most of the women, as other speakers have told, okay, they don't go for the screening. They are not aware. Unless you have a problem, they don't want to take up the screening. They don't want to go for the pap smear and all. So, which is why screening is very, very important. The signs of cancer are vaginal spotting or bleeding after sexual intercourse, between menstruations or after menopause, and a foul smelling discharge that does not go away even with treatment. Suppose somebody has got a discharge which is not going, that has to be attended and taken care of. So screening is one of the important tools. It is a test on people who are healthy and without any symptoms. That's what screening means. You don't have to do it on people who are already affected with that. It is to identify those with a higher chance of getting a particular disease. A cervical cancer screening test can be done if cervix is normal or not. It can detect early signs of disease before a woman has symptoms, when treatment can prevent and disease is developing. When screening, if suppose even if you found HPV positive in that, we can go for the vaccine that protects from the other serotypes. The most important screening test is Pap smear. When physicians will do a genital examination to look at the cervix, collect a sample and then test it for, send it for the test. Other tests are sometimes used for screening cervical cancer. Looking at the visual examination is very important, and putting a vinegar or Lugol's iodine on it. That is also one of the tools, which I think Dr. Leela is going to emphasize on that. So now the question is, can cervical cancer be treated? Yes, it can be prevented and it can be treated if suppose it is diagnosed very early. That is the reason the significance and importance of screening is mentioned here. A routine screening should be made mandatory, and for that we have to bring awareness in all the women as we go. See, a simple reason, we have a car and we take the car every 6 months for doing screening and checking it for the servicing and all. But as a human being, we never go for the screening. We never go unless we have a problem or we have some issues with us. So most cervical cancer can be successfully treated if it is found early. In middle-aged women who have never been screened, cancer may be discovered late, when it has already spread beyond the cervix and is more difficult to treat. So let us not go to that stage where it becomes untreatable. Most of the diseases, most of the cancers can definitely be treated, provided we are cautious about it. We do all other things except taking care of our body. So what are the treatment options? Are surgery, radiation, chemotherapy, which I'm not going to go into depth of it. So it can be treated, it can be prevented also. So we are talking more about prevention of that. And that's the reason why we want to target the young girls who, before entering into the sexual encounters, they should be screened, they should be given the vaccine, so that in future we can also reach better targets than Australia and New Zealand, where they give the vaccines to all the children. Prevent by education, screening and vaccination, and it has to go as a mass program. And I'm sure Dr. Chaturvedi is going to take care of that, and we are all there with you to help out. The disease burden of cervical cancer in India is almost about 72,825 deaths annually. Approximately 200 women die every day, 8 women every hour, and every 7 minutes a woman dies of cancer. So this can be prevented, but only thing is we have to bring the awareness, and the awareness level has to be at a very high level where they should know, yes, they should go for the vaccine. And one of the important tools of bringing awareness is by adding up into your immunization schedule and having programs regularly, where we have to encourage, we have to educate the people, especially the mother as well as the school children. We do programs with Bindu and other adolescent colleagues in the schools and teach them about this. And then we have definitely increased the rate. So HPV vaccine are highly effective at preventing the infection. Susceptible women with HPV types covered with the vaccine HPV vaccine should be given females before they reach an age when the risk of HPV increases. HPV can be given to females between 9 to 26. We should definitely give it, but it can also be given up to 45 after screening. HPV is given in 3 doses, which Bindu has described in detail, 2 doses for children between 9 to 14 years. So there are 2 vaccines. One is a quadrivalent, one is a bivalent, and a new 3rd vaccine has come, which is a 9-valent vaccine. So the key points are cervical cancer is a leading cause of cancer death in India in women. The primary underlying cause of cervical cancer is infection with human papilloma virus. Most HPV infections, they resolve spontaneously, but those that persist may lead to development of pre-cancer or cancerous state. It usually takes about 10 to 20 years because it's a very, very slow growing disease. So that is the reason screening is very important in people who have not taken the vaccine. Over 80% of women newly diagnosed with cervical cancer can live in developing countries. Most are diagnosed when they have advanced disease, because when they have bleeding or when they have any associated symptoms, then only people go for the checkup. If left untreated, it can become fatal. HPV vaccine is highly effective in preventing. So I make it a point and emphasize that HPV vaccine should be given to every girl child in India to see that the protection rate increases and no child should have a problem with HPV and die with cervical cancer. Thank you so much. Over to you, Dr. Chaturvedi.
Unmute yourself, sir. Chaturvedi garu, unmute yourself.
Sir, thank you very much. Very kind of you. Yeah, we are very proud that you are a member of our Rotary Club of Hyderabad Pearls. Let us really see that something good happens to the society without any self-interest. We are working, and I am very sure we'll be able to reach the goals. Thank you so much. Very kind of you. It's a very elaborate presentation. And now, coming back.
Sir, I have a doubt. Can the doubts be taken the last, or can I?
Okay.
You told that 9 types of cancers are there. So this HPV vaccination can cure all the 9 types of cancers?
There are 2 types of vaccines now. Actually, now we have got quadrivalent vaccines which we are giving it. But the most common type of cancer which are there is 16 and 18. That is a quadrivalent vaccine. Now, the new vaccine which has come is a 9-valent vaccine. So which is covering all the 9 types in that.
You can afford it. It's about 10,500.
Yes.
Money.
Yes.
Yeah.
And that also it has to be given in the same age group, 9 to 14 years?
Yes, it can be given.
Okay. Thank you.
Thank you. Thank you very much, sir. Very kind of you.
Thank you.
Now we have a very, very important speaker. We have a dream actually to start a training program on cervical pathology and colposcopy. And she's in the right position. She's the president of the Society for India. Now, I would request Madam Meeta Singh to introduce Dr. Leela ji.
Yeah.
Yeah. They're all very good friends. I thought it's a privilege for me to see that Dr. Meeta ji introduces her. Yes, please.
Thank you. Thank you so much. A very good evening to everybody. And thank you, Mr. Chaturvedi, for having me in. And it's, of course, a great pleasure to invite and introduce Dr. Leela. Presently, she's, of course, the first thing is she is a very, very dear friend of mine. And we have worked very closely in a lot of academic activities, right from the days of Saint Teresa, where she would invite me for her teaching programs. And we have actually journeyed through a lot of academics and a lot of teaching programs and writing of books as well. So we have co-authored the guidelines of menopause, and her interests are varied. In fact, she excelled in the credential exam, the menopause exam, which we hold from the Indian Menopause Society. She topped that list. But her main interest is oncology. So she gave up everything from Hyderabad, and then she went to Vizag, where she's part of the oncology team over there. And her passion has always been prevention of cancer. And very rightly, now she's heading the Indian Colposcopic Society for this year. And we wish her all the best, and I'm sure she'll be doing a lot of good things in her tenure. So over to you, Leela. It's a pleasure to have you here.
Thank you very much, Dr. Meeta, for your kind introduction. I know how you used to encourage me to be part of IMS. I do miss that. But anyway, I'm making myself busy with the Indian Society of Colposcopy and Cervical Pathology. So at the outset, I should thank Dr. Chaturvedi for his enthusiasm and all the time doing some or other activity to stimulate people like us. So at the same time, I wish all the participants who are here, I know the number is not much, but still they're very enthusiastic.
We are going on the YouTube. There should be
Yes,
people.
sir. Yes, I have seen, sir. So yeah, their interest to participate and listen to. And actually, we had a very nice introductory speech by Mrs. Govil, and she has put a nice analogy between HPV and COVID, which actually I often use, especially with regards to counseling of parents when they want to vaccinate their daughters. So this is already, I have started doing it. So without wasting much time, I'll share my screen and
you are a co-host, ma'am. You can go ahead.
Yeah, is my screen visible?
Yes.
Yeah, so I'm just talking about my experiences of the problems what you people have already enlisted in the previous 2 lectures. So just my practical experiences I'm trying to share. I'm not talking any theory here because this is already extensively covered by Dr. Himabindu and Dr. Singh. So we all know that there is a lot of vaccine hesitancy, and how I tried to overcome in my own way and make a beginning at Visakhapatnam. So we all know, we already have heard a lot that HPV infection causes cervical cancer. And at the same time, we also know that HPV vaccination prevents cervical cancer. For that matter, not only cervical cancer, the HPV related cancers can be prevented by taking HPV vaccination. And a lot of research is pouring in, and a lot of studies are looking into many other aspects of advantages of HPV vaccination, like even into the obstetrics. There is one study where they say that it will prevent this vaginal infections, and thereby it can even prevent preterm labors related to HPV infections. So much of research is happening because we just want to encourage the young girls to come forward to take the HPV vaccination. So we all know about this global call, which was initiated in 2018, and later it came into shape in 2020 about cervical cancer elimination as a public health problem through 3 steps actually. And the important 2 steps are, one is intensified vaccination against human papilloma virus and screening. And it doesn't end with vaccination and screening. All screen positives need definitive treatment. So this is the global call. So we are all working towards that global call of eliminating cervical cancer by 2030. So in 2017, there is a position paper which was released by WHO about HPV vaccination. It should be included in the national immunization program. That is what being stressed by everybody here. It should be a strategic part of coordinated and comprehensive program to prevent cancer and other diseases caused by HPV. So the primary target is all girls between the age of 9 and 14 before they start sexual debut. Then targeting multiple age cohorts instead of just giving vaccination only between 9 and 14. Instead, if you can extend it up to almost up to the age of 26 years, if they are not sexually active. And for that matter, some of the recommendations say that you can even give up to 45. But we need to emphasize more about screening than vaccination in women who are sexually active after the age of 30. Because especially when if it is going to be a government program, we need to make sure that resources are utilized properly. We know that it is introduced in 112 countries. Coming to India, it's only in 2 or 3 states this HPV vaccination is started as a state health program. In that, the first one is Sikkim, and later now Punjab has taken up. So coming to the beginning of HPV vaccination in India, even though it is licensed by drug controller in 2008, bivalent and quadrivalent vaccines and nanovalent in 2018. Initially, it was started by PATH as a project in Andhra Pradesh and Gujarat in 2009. But to our bad luck, some deaths happened and they thought that it is all related to HPV vaccine and that project was stopped. And they never restarted that project. So that is how the beginnings happened in a very unpleasant way. Then after that, we all know that health is a state policy. It is not the central government's policy. So that's why in 2016, Delhi was the first state to initiate a public HPV vaccination program for school children aged 11 to 13 years on National Cancer Awareness Day in 2016. Of late, recently, I heard that in some of the government hospitals, they are giving this HPV vaccine free. I'm not very sure about that, but I heard in one of the meetings. Then, as Dr. Chaturvedi rightly said, in 2018, government of Sikkim as a state health policy, they have started school vaccination program free of cost. In the sense, the government has funded the entire program and their coverage is almost more than 95% in all the eligible adolescent girls. And likewise, at the same in 2016, as a pilot project, the Punjab has initiated the program. So we are all hoping that our state governments also take this initiative and start a statewide immunization program. We hope that it will happen one day in future. But before the government takes up any of these programs or including it as a part of national immunization program, I know several organizations are trying to push the government forward, but it is still not taken the light. Leaving that aside, we need to do something, what we can do from our end, because we are all NGOs, several NGOs have assembled here to do something to promote this HPV vaccination in public. So before actually you start, you have to understand there is something called vaccine hesitancy. Why there is so much of vaccine hesitancy happening in public? So that is what we need to understand. So if we understand that there is an issue called vaccine hesitancy and what are the factors that are responsible for this vaccine hesitancy, then we can slowly start trying to work on those factors to reduce those hesitancy factors and moving more closer to the public. Because many people, when you start something new, like when COVID vaccine started, people were very reluctant. Even the government was giving free. Even doctors themselves were very reluctant to take this vaccine. And there were so many questions about why we should take vaccine. Will it be protective? Something like that. When this HPV vaccine, when you talk about it, many parents will ask us the same question. Will it be protective? Will it really prevent cancer? So like that, so many questions. And as rightly said by Dr. Himabindu, people think that it is something, because we talk about sexual activity and vaccine, they think that it is something going to cause a promiscuous behavior or something like that. So the moment you talk these things, the parents themselves will be hesitant. And of course, the most important factor which is responsible for this vaccine hesitancy is, I sincerely say that it is the cost. So however much you try to help them by taking from the distributed directly, but still the cost is not within the reach of a lower middle class. But unless you counsel them vigorously, compare them the cost with something what they spend there for a birthday or for a dress or something like that. And unless you say that what are the long-term benefits of a vaccine cost versus somebody getting cervical cancer, the morbidity, mortality, the mental, physical stress related, the cost, like that, unless you keep on comparing and telling them, they won't be in a position to take this vaccine. And majority want the vaccine to be given free of cost. So these are all the main factors which are the hindrances to move forward with regards to HPV vaccination. And likewise, many people think that this HPV may not affect them. They are not the ones who are going to get infection or cancer. So why should they take this vaccine? So like that, so many things. And more than that, apart from the parents not having enough knowledge or uncertainty about the usefulness of the vaccine, and of course, safety issues are always there. At the moment something goes wrong, it will be magnified in such a way in the social media that all others will stop understanding the useful benefits or benefits of the vaccine. And likewise, not only the lay public, even the health professionals themselves are not having enough knowledge and attitude, because in a busy practice, I'm very happy that Dr. Singh told me that 95% of the adolescent girls coming to their hospital take the vaccine. So that means he's really spending time to counsel them as well as their parents. So unless the doctor is motivated, unless a health professional is motivated, this knowledge will never go to the patients, or we will not be in a position to counsel them. So we need to spend some extra time to counsel and then slowly make them understand, and then stimulate them to take this HPV vaccine. It's when you start actually talking to the patients, your nurses themselves will understand. They themselves will bring their own people, their own friends, relatives, and start explaining to them the advantages of taking this vaccine. That is what my personal experience is. My nurses are so well trained. So they themselves will go and tell them, oh, I have given vaccination to my own relatives, so why don't you come forward like that? So all these things take a lot of effort. Then of course, political, I need not really talk much about it. The political public health policy decisions, the government's priorities, the cost, so many things make these political problems and the policy decisions by the government. Then social and cultural, I have already stressed about these social and cultural perceptions about, especially with regards to HPV vaccination. Then the solutions, how you can overcome some of these hurdles and move forward. So the solutions, what I thought or what we have implemented are like this. One is advocacy at all levels, attitude change, accountability, availability, accessibility. So advocacy is a very important aspect. You can't just go and start giving vaccine. You need to go to schools. I feel schools are the best places where you can meet the teachers, students, and the parents. So the parent-teacher meetings, you can actually simultaneously counsel the mothers, or both mothers and fathers, and then their daughters, so that you can encourage them for screening as well as for vaccination. So that is what we did in 3-4 government schools, and that helped us a lot. So we can actually create nice cartoons or leaflets in local languages, and that will give them an adequate information. So slowly these things will help to bring attitude change. So it's not just going and talking to people. You need to take some accountability. That means you need to go with some idea in your mind. Yes, you are motivated. Are you ready to come forward for screening? Or are you ready to bring your daughters for vaccination? So you should make some kind of a tie-up with NGO, or you need to be in a position to get some funds and start doing things. And then you can negotiate with the distributors to get the vaccine at the lowest possible rate, so that it will be beneficial to the NGOs also who are funding it. So then accessibility. So another problem is if you want to vaccinate girls in the remote villages and other things, it will be very difficult for them to come to you. So either you should be able to go there with all the logistics and with the support, or you should be able to bring them to your own center and do this screening and vaccination program. So all these factors we have taken into consideration. So what we did was we went to some village schools, motivated them, then brought them to our hospital. We arranged everything for them, and then did the screening, did the vaccination. And we also maintained the schedule and everything by ourselves. And we used to send the reminders when they are due for their the second dose or third dose. We used to call them, and we have done the vaccination to them. And once the mothers finish their screening, we used to keep all the data, record maintenance and everything. And once the reports are ready, we used to call the screen positives and offer them the subsequent tests and the treatment. So that is how we have to maintain a continuity, or the chain has to be maintained. So this is just a CAP analysis, because we heard that many are not aware. Yes, many are not aware about cervical cancer, screening, vaccination. Many are not aware. So whenever you go to any screening camp, just going and seeing and doing the camp, try to analyze their knowledge. So that will actually help you where you stand. So this is a very small study which was done long ago, because whenever I was going for any screening camp, I used to take my social worker. So he used to collect all this data. There were about 1,200 women participated. Majority, for some reasons, they told us that they heard about cancer, because most of the screening camps, what we did were with the help of the volunteers. So the volunteers used to go to the villages before and used to educate them. So that's why probably they all gave a very high percentage that they heard the word cancer. And they also knew that tobacco and alcohol cause cancer. But when it comes to screening tests and awareness about HPV vaccination, the percentage is very dismal. And even today, every day in my clinic, before I do the screening test or before I talk about HPV vaccination, I ask each and every woman about their awareness. And after that, I'll ask them whether are you ready to have a screening test. So after talking to them, after understanding their knowledge, the majority, almost 100% say, yes, we are ready to have the test. Then that's what here also the same thing is shown in this study. As long as it doesn't interfere with their work, as long as it is not a burden for their economic condition, I think majority of women do accept screening and bring their daughters for vaccination. So this is all the ones which I have already said about how we have done our work. So these are all the pictures. Just I put it more pictorial so that people will have, the audience will have an interest. So this is going into small communities, talking to the women as well as their daughters. So this is in a school. You can see the parents here. You can see the teachers here. Sorry, parents and the students here. And then, of course, like how you are trying to bring in so many NGOs in and around Hyderabad. We also luckily had so many NGOs helping us in Visakhapatnam. Manav Seva is from US, and this Srinivasa Seva Samiti, Vikasa Tarangini, they are all from Vijayanagaram. And this Eco Carbon is, he is a local person in Visakhapatnam. And then Vizag Steel Plant, as a part of their corporate social responsibility, they have 2 schools in their campus where they wanted to do this screening and vaccination program. And then this Mohan Foundation is actually from Hyderabad. They also helped us to do this screening activity in a village called Uddandapuram, close to Visakhapatnam. So this is again some pictures where we were going into the community and talking to people and doing the screening, as well as basically this screening. Those days I was doing screening in the community before COVID, but vaccination I didn't do in the community at that time. They all used to come to the cancer hospital where I was working at that time, and they had the vaccination there. So these are the pictures. This is actually, we went to a village and talked to the people there. Then these are all the children and some of their mothers. Then all of them have come to a hospital in batches. And then we did this combined activity. Yeah, so this is, yeah, you all need some social media to propagate your activity. So this is how we have given to the press, and they helped us to spread the awareness, because one volunteer or one NGO doing something, the other NGOs also would be stimulated and they would come forward for helping the activities. So these are the very brief statistics of the schools, 4 schools. I know the numbers are not huge, but the success is the one which actually stimulated us to do more and more activities. So this is, each school is represented by one color. And these are all the number of the girls, because in government schools, you do see small number of girls in entire school, the high school from 6th class to 10th class. And then the below 15 years, above 15 years, because this is to calculate the dose schedules and the number of doses. Then what is the completed, how many have completed. So in majority of the schools, more than 90%, we could bring them for the vaccination as per their schedule. So that we could do. Yeah, this is again one picture of all the mothers and children who have come to our hospital for the activities. And then this is another big picture. So my what I'm actually looking into future, I know we are of late seeing in papers, in public, in social media that Indian vaccine from Serum Institute of India is going to come to market soon. Some people say that it is going to come into market in June or July, something like that. And we recently had a study which is published in Lancet about single dose, which is India is also a part of that study. So if single dose is found to be equally effective, 2 and 3 doses, if single dose is going to be effective, I think we can vaccinate more and more young girls. Then improved awareness amongst public and medical fraternity. And definitely public and private partnerships play a major role. I know all the professional bodies are working towards government, making the government understand the importance of this HPV screening, vaccination and everything. And then I think the government hopefully should come with some policy. And we are actually planning to restart. And I think already some projects are already in pipeline, and we are hoping to start or rather restart on March 8th, that is Women's Day. One nearby village school people wanted the school girls to be vaccinated and their mothers to be screened with the help of this EcoCarb NGO. Hopefully, I think if I initiate or I restart, I think I can again come with new figures and new statistics, because all these figures are all before COVID. So I just want to move forward. And now, even in our own hospital, we have started, I'm very happy to share that we have started gene expert HPV testing. With the help of a research fund, we got the machine, and we do ourselves this HPV testing. So it's just like a one-stop clinic. The lady comes, I do the smear, I do the sample, I put it into the machine, I get the result. If the result is negative, I'm very happy. I'll call her after 5 years for screening. If it is positive, I can do colposcopy immediately. And if it shows anything, I can treat her either with cryo or with thermal ablation, if it is possible for ablative treatment. Otherwise, I'll take a biopsy and I'll call her back for excisional treatment. Slowly, I'm moving towards one-stop clinic, and simultaneously in hospital, I'm able to continue with the vaccination. I know the numbers are not huge, but still I'm able to continue with that activity due to this COVID pandemic. And as Dr. Himabindu said, slowly the pandemic is settling, and I'm hoping to restart the activities soon. So with the help of all the NGOs. So yeah, this is, so we need to say that we are no longer hesitant to take the vaccine. We all should say that vaccine hesitancy, goodbye to vaccine hesitancy, and start moving forward. And on this HPV, International HPV Awareness Day, which is March 4th, 2022, that's why we are all here. So we need to have one less worry, not only for parents, but also for our daughters, one less worrying about HPV and HPV related cancers. Thank you very much for giving me this opportunity. Thank you.
Thank you, Leela. That was very motivating, I think. And I think the best part that I liked about your, of course, because the rest of it for medical people is something what we heard, but it must be very interesting for the layperson, the amount of tremendous work that you have done on this field. I am very enamored by your future vision. And I think that's really what keeps us going. And I really also liked the concept of one-stop clinic, but you're very fortunate to have that HPV there with you. I'm sure there are very hardly any centers who could afford to do that in India. not just in in Hyderabad, not just in Andhra, but maybe all over India also. Though there may be institutes, but then they will be so busy they cannot do that one-stop thing at a time. So I think, yeah. So you're following your passion, and I'm so happy to
Thank you.
hear that you're doing this one-stop clinic, which is so wonderful because it gives you so much of a satisfaction. The woman doesn't have to keep moving and waiting, that anxiety about the test and the treatment. So all that gets cut down. Congratulations. And sorry, Mr. Chaturvedi, I had to say this, so I took the mic before you could take it.
No problem. So how you are passionate about menopause, osteoporosis, I think I have become passionate about cervical cancer.
I could see that in your presentation.
Dr. Meetaji, I'm so happy today. I mean, that things are going very well. It's only very unfortunate. Even when we are creating an awareness, there are not many participants. I hope some people say I gave so much of advertisement about this in social media, including international institutions. I hope they are seeing it on the YouTube, though they could not directly participate in this. But then I still have a lurking doubt. How do we reach the people about awareness? If this is the way, we did a walk in the morning.
Yeah, I know.
In a medical college students were there and nurses were there. When we asked how many people know about HPV, no answer. And then I asked one question: how many people have taken COVID vaccine? Everybody lifted 2 hands, not one. But then I said, how many people have taken HPV vaccine? None.
And still they have not attended the program.
Sorry?
I said, did you ask them to attend today's program?
No, I told them, you are going to be my ambassadors. First you take, and then go and start talking about it to others.
Yeah, no, you should have invited all of them to attend the program.
I have sent it to every lecturer, everybody about this program. I have circulated it.
Yeah.
But
that is the saddest part.
Saddest part, because I'm very happy. Today, I feel very strong because I'm doing screening program this month in 4 centers. Nalgonda, Medchal district 2, and then also in one more district. We tied up with the Rural Development Department, and then with the state government support, we are doing it. We have a project sponsored by the Novartis, and then it's a 4-year project. So we are doing it almost 4 camps every month. We are going to see that entire Telangana is covered without leaving any single district and mandal also. Plus, along with Himabindu Singh in Nilofer, you all know that we have taken up doing this swasthava cancer care, Rotary and Nilofer. We are working on making this dream a success.
Correct.
Incidentally, since both of you are here, I was talking about cervical pathology and colposcopy training program to be started. I discussed with two hospitals which are doing pre-cancer, cancer prevention program. This comes under cancer prevention program. But then they're still working out the modalities and all that. But I would request both of you to kindly take it up and see that this education is given because this is most essential. And ma'am, one point I wanted to ask Dr. Leela. You are doing this HPV test in a machine. How much is it costing you per test?
Actually, yeah. The cost is, right now our hospital has put it as 3,000 for those who can afford. For those who can't afford, they have put it about 1,050.
Yeah, that is, 1,050 is something even sponsors do not give for a HPV test.
Yes, that is what we feel. But what happens is, if it is a reliable test, the test which has got high sensitivity, and once you do the test today, you need not call them for the next 5 to 10 years. The latest WHO recommendation.
10 years.
Yeah.
10 years.
So you can even delay up to 10 years. So, I mean, that is the main thing. That ideology has to change, because we all think about the immediate cost, but we should think about the long-term benefits. So if you think about the long-term benefits, actually, Dr. Govil was nicely saying that we should come out of VIA and VILI. She says HPV or pap smear. So only thing is with the pap smear, yes, I mean, wherever people can't afford, I still do pap smear. I rarely do VIA as a primary screening modality. Even when I was going into community, I was doing this pap smear. I never somehow was not very comfortable in doing VIA alone as a screening test. Yeah. So it all takes time.
But I think now the WHO is promoting HPV as a standalone test rather than the co-testing if it is possible. And actually, if you look at the final economics, see, you're cutting down the entire manpower that is needed to do the pap smear. This is machine generated. So all that manpower is cut down, you know, and definitely the accuracy rate also, the pickup rate also goes up. And once in 10 years is nothing for 1,000 rupees if we can bring down the cost like that. 3,000 is far-fetched, but 1,000 rupees.
There's one lab that has already offered me for 1,000 rupees.
Yeah. So that's what they can bring down the cost. Actually, we are also doing a study, Leela, along with the Indo-American people. They wanted the samples. So they are doing a study on this HPV. So they are doing it. They're doing the LBC plus the HPV for 800 for us. So like HPV is zero cost, and for the LBC maybe they are charging about, and we are part of that project just now. So we are doing LBC plus HPV co-testing for 800 rupees. So that way I think a lot of awareness is going on, but like you said, the interest is not there. And Mr. Chaturvedi, whatever programs you're doing, all these cancer screening programs, and very rightly Leela has also put it in her presentation, with the help of the Mediva group. Now, that's a wonderful group who will document your data, and it becomes very easy. So it's worth, it's worth spending a little bit on that, because there is no point in just going on working if you don't have your own data. Yeah. So all the screening, from that you will know what is happening in the real world. How many people are having what problems. So documentation is very important, I think.
We are sincerely thankful to you because you have introduced Mediva to us, and we are using the package, and we have developed many more areas also in that.
And I'm sure you'll come out with excellent data, which can be, and they also help out very much in analysis and, writing a paper. So I'm sure you'll be able to do a fantastic job after this.
The only problem we are facing is when we get some cases which are precancerous, going back to them and persuading them to come for a cervical biopsy, for which we pay, but still we are not able to motivate them to come and then take it.
That is
the big problem. And when we go for a second sample, they will never come back. That's the reason why we are doing pap smear, VIA. We are also doing lugal side, taking an image with the colposcopy, so that in one go we have all the tests.
I think that is what the Chennai people must have gone through all these phases, and that's why they did that one time kind of a treatment like what Leela is speaking about. Not with the HPV, even with the VIA, or the colposcope. Now we have the handheld colposcope. So whatever it is, you identify, at least you treat, so it doesn't progress.
I mean, we have even to.
So there is nothing like going back. So I think that kind of a thing, maybe you can take guidance from Leela and create that module where you're going one stop at the peripheral levels.
I totally agree with you.
Peripheral levels, many people do screen and treat. That means they do VIA.
Yes.
If VIA is positive, and if it is amenable to treatment, they will do cryo. So that is now actually thermal ablation has come. It's even easier than doing cryo, because for cryo you need to carry the cylinders and everything.
But now, these people they are able to procure the handheld colposcopes also.
True. Yes.
So this group, so it becomes even more better.
Yep.
The pickup rate becomes much more better, and I think maybe like Mr. Chaturvedi is saying, we should have some training sessions and create a module for them where they can use it.
Should have some
and also they have the database where they can collect the data also and come out with this model, where instead of really using the colposcope and then getting the results.
Exactly.
Yeah. Okay, thank you so much.
Colposcope is with artificial intelligence. You press it and the result is given.
Yes, that's
So-
what that is what I'm saying. I mean, we are far better than what it was when Mr. Shankar Narayan had done in Chennai. And you also have a technology group who is immediately collecting the data. Imagine those people used to write on papers and Excels and work so hard. Now everything is at the click of a button. We just need to have things in a format. That's it. I'm sure Leela and me can, if you want, we could help you out with this.
I know, surely that's she is
It
my
is
very
better.
favorite speaker. Whenever I have a session, I never miss her.
Yeah.
Thank you.
Thank you
Okay,
so much,
then.
ma'am.
Thank you so much, and
I feel-
goodbye and good night.
I feel I'm educated. Thanks to everyone. I would now request Vani, our secretary, to please give vote of thanks.
Good evening, all. I thank our today's chief guest, Dr. Josna Govil, and our today's speakers, Dr. Himabindu Singh, Dr. Naunihal Singh, and Dr. Leela Digumarti Garu for sharing us so much of knowledge on HPV vaccinations. And I also thank Dr. Chaturvedi Garu and Swasthava Cancer Care. Thank you all.
It was a very nice session, ma'am. Thank you so much. Thanks to all the speakers who made my day today. Thank you. Namaste.
Thank you.
Thank you, Vani.
Yeah, thank you, sir.
Okay.